Yeah, you ready? The subcommittee will come to order. The chair recognizes himself for an opening statement. Tomorrow, the subcommittee will consider legislation reauthorizing the Animal Drug User Fee Act, ADUFA, and the Animal Generic Drug User Fee Act, ADUFA, and a discussion draft on securing the pharmaceutical distribution supply chain, also known as track and trace. On April the 9th, this subcommittee held a hearing on ADUFA and ADUFA, two successful user fee programs at FDA that expire on September 30th, 2013. In 2003, ADUFA 1 was authorized to help the Food and Drug Administration's review of animal drugs. Similar to the prescription drug user fee for human drugs, under ADUFA, FDA collected funds to help expedite the new animal drug approval process, reduce the application backlog, and improve communications with drug sponsors. The program was authorized for 5 years, and Congress renewed the program for an additional 5 years in ADUFA 2 in 2008. FDA and industry have negotiated an agreement regarding the size and scope of ADUFA 3, which would extend the program through FY 2018, and these recommendations were delivered to the committee in February. Under the negotiated proposal, industry would pay approximately $23.6 million in FY 2014 and similar amounts adjusted for inflation for FY 2015-2018. ADUFA 1, ADUFA's generic cousin, was first authorized in 2008 for 5 years in order to improve the review of abbreviated new animal drug applications, eliminate application backlogs, and reduce review times. FDA and industry have also negotiated an agreement for ADUFA 2. Under the proposed ADUFA 2 agreement, industry would pay $7.328 million in FY 2014, which allows for the hiring of 22 full-time equivalents and includes a one-time cost of $850,000 for information technology, $6.944 million in FY 2015, $7.429 million in fiscal year 2016, $7.936 million in FY 2017, and $8.467 million in FY 2018. The legislation to reauthorize ADUFA 3, H.R. 1407, was introduced by Representative John Shimkus, and the ADUFA 2 reauthorization, H.R. 1408, was introduced by Representative Corey Gardner. Tomorrow, we will consider an amendment in the nature of a substitute to combine both bills. Regarding track and trace, on April 25th, the Health Subcommittee held a hearing on the Latta-Matheson discussion draft, which provides a uniform framework for securing the downstream pharmaceutical supply chain, which includes manufacturers, wholesale distributors, pharmacies, repackagers, and third-party logistics providers. Securing the supply chain through this bill will help ensure that counterfeit or stolen drugs do not enter the supply chain and harm patients. It will also ensure that overlapping red tape does not impose dramatic cost on patients in the form of higher prescription drug costs or potential drug shortages. Several changes have been made to the discussion draft since the hearing. Most notably, the updated discussion draft contains two important changes to address concerns from some of my colleagues. First, it ensures that a prescription drug product's transaction history will be required starting on January 1, 2015. It also includes a framework to move towards unit-level tracking in a manner that ensures a collaborative process between FDA and stakeholders, respects the unique nature of small businesses and dispensers, and most importantly, is practical and achievable. I look forward to moving these important pieces of legislation to the full committee, and this time I yield back and now recognize the gentleman from New Jersey, Mr. Plone, for 5 minutes for his opening statement.
Thank you, Chairman Pitts. Today we're marking up legislation on two important topics, the the Animal Drug and Generic Drug User Fee Amendments, and the Pharmaceutical Distribution Supply Chain. As a co-sponsor of the ADUFA bill, I encourage my colleagues to support this critical legislation. Congress enacted ADUFA to help improve the FDA review of new animal drugs, and subsequently enacted ADUFA to improve the review of abbreviated new animal drug applications or generic versions of animal drugs. These programs have been extremely effective and have helped expedite the approval process, reduce application backlogs, and improve communications with drug sponsors. It's important that Congress act before the agreements expire at the end of the fiscal year so that progress is not impeded and the Food and Drug Administration can continue to review new and generic drug applications in a timely manner. Industry, farmers, ranchers, and pet owners are counting on an uninterrupted supply of animal drugs. The topic, Mr. Chairman, of our second bill today, drug distribution security, is also critical to public health and safety. The public deserves to know that the prescriptions they receive are safe and effective, and that the product can be traced back to the manufacturer, wholesaler, and other parties involved if necessary. Given the importance of drug distribution security to all of our constituents and the meaningful bipartisan, bicameral conversations we had last summer on this issue, I'm disappointed that the committee has not worked in a bipartisan, good faith manner on the version of the bill that is being marked up today. At the hearing we held a couple weeks ago on this topic, I urged the subcommittee to work together to make sure we got this proposal right, and unfortunately that hasn't happened. Allotting 30 minutes to go over the discussion draft with my staff and then introducing a new draft with no further substantial dialogue and then claiming it is in the spirit of compromise is discreditable. This is deeply regrettable, and it's not how the committee should operate. While the bill before us today is a step in the right direction, it's not the leap we need to get to a solid proposal that will truly bring security to the pharmaceutical distribution supply chain. Most importantly, I'm concerned that the bill under consideration does not have a clear path to self-effectuating unit-level traceability. The bill would require FDA to issue only a proposed regulation on unit-level traceability in 2027, and there's no timetable for a final rule, so we can only imagine that the implementation date following the issuance of final rule would be at least 2 years more, and 2029 is too long of a wait and simply unnecessary. During our hearing, industry indicated that it would be able to successfully implement unit-level traceability in a shorter time frame. The public should not have to wait for peace of mind when it comes to the safety of their drugs when the technology and tools are available to provide that security sooner. In addition, the bill preempts state law from day one of enactment, but requires no passage of transaction information and history until 2015. It makes little sense to me that a state operating with current pedigree requirements in place would have to remove these public health protections until federal requirements kick in down the road. As I've said before, it's crucial that if we're going to preempt state efforts, we must provide a strong federal standard in a timely fashion. Finally, in order to establish the most effective drug security system, we need strong licensure standards for distributors and third-party logistic providers. I believe that licensure standards should act as a floor, not as a floor and a ceiling as they do in this bill, so that states can put in place further requirements as they see fit. I look forward to addressing the animal drug user fees and the pharmaceutical distribution supply chain bills and have a productive dialogue with my colleagues about these issues so that we can send the best legislation possible forward, Mr. Chairman of the full committee, and ultimately to the full House. And I yield back.
Chair, thanks, gentlemen. Now I recognize the Chairman of the full committee, Mr. Upton, for 5 minutes for his opening statement.
Well, thank you, Mr. Chairman. Today we're going to consider important bipartisan legislation to reauthorize the animal drug user fees and secure our nation's prescription drug supply chain. First, we're marking up H.R. 1407, Animal Drug User Fee Amendments of 2013, which would reauthorize the Animal Drug User Fee Act, ADUFA. The amendment, in the nature of a substitute to H.R. 1407, would simply add the language of H.R. 1408, a bill to reauthorize the Animal Generic Drug User Fee Amendments of 2013, ADUFA, to the bill. The American people have benefited greatly because of ADUFA and ADUFA, ensuring that veterinarians, livestock and poultry producers, pet owners have access to the drugs that they need to keep their animals healthy. The programs have also assisted animal drug manufacturers by creating a stable and predictable FDA review process, and they have helped in keeping the American food supply safe. Reauthorization is critically important for companies like Zoetis, which employs over 700 folks in Southwest Michigan, as these programs provide the predictability that they need to help produce innovative drugs for pets and livestock. Today, we're also going to mark up the bipartisan discussion draft on securing the prescription drug supply chain. This draft would work to protect American families against counterfeit drugs while eliminating hundreds of millions of dollars worth of duplicative government red tape, saddling American drug manufacturers, wholesale distributors, and pharmacies. We've worked on this issue on a bipartisan basis for well over a year. In last March, we held a hearing on securing the supply chain as part of our reauthorization of the Prescription Drug User Fee Act, ADUFA. Our discussions continued during the ADUFA negotiations with our colleagues in the Senate and throughout the remainder of the Congress. But sadly, we didn't get it done in the last Congress, but it's my hope that we'll have a bill on the President's desk by the August recess. We've also sought input from stakeholders like Pfizer and Perrigo in Michigan, as well as our small pharmacies. This hard work is evident in the legislative product that we'll consider today. This subcommittee held a productive hearing on the discussion draft on April 25th, and last Friday we released a new discussion draft which would require manufacturers to pass transaction statements starting in January of 2015 and phase in that requirement for wholesale distributors and pharmacies. This will bring real security to the supply chain in just a few years. The draft also would set forth a collaborative process so that the FDA and supply chain stakeholders could work together in an effort to better understand how to move unit-level traceability. Finally, it would require the FDA to take what it learns from that collaborative process and issue a proposed reg on unit-level traceability in 2027. When it issues this regulation, the FDA would have to take steps to ensure that small pharmacies are not being overly burdened. This markup is an important step in finishing the bipartisan work on securing the prescription drug supply chain that we began well over a year ago, and I yield back the balance of my time.
Chair thanks the gentleman. Now I recognize the gentleman from California, Mr. Waxman, for 5 minutes for his opening statement.
Thank you, Mr. Chairman. Today we consider a bill designed to improve the integrity of our drug supply chain. Unfortunately, this bill falls far short of achieving that goal, and it falls far short of what we as a committee can and should be doing. Throughout last year, members on a bipartisan, bicameral basis engaged in extensive discussions on legislation to protect our supply chain. I was part of this group, as was Chairman Upton and Representative Pallone, Dingell, Matheson, and Bilbray, who was a member of our committee last year. Last fall, that group released a proposal that reflected the array of potential policy solutions put forward by members of that group. Last month, Senators Burr, Bennett, Harkin, and Alexander distributed a draft bill built upon that proposal. Although I do not agree with everything in it, their draft clearly represents the Senate's concerted effort to balance issues that were raised on both sides of the aisle throughout last year's discussion. In stark contrast, the bill we are considering today fails to strike that balance. And in stark contrast to the collaborative bipartisan discussions of last year, my colleagues across the aisle did not engage in more than a couple of brief meetings at which they informed us of what the bill would look like. In the version of the bill we're considering today, the authors have made some minor changes to address concerns we have raised. Those changes are a small step in the right direction, but they fail to address our core concerns, and that is why I cannot support this bill. Throughout our months of discussion last year and at our hearing 2 weeks ago, we repeatedly heard loud and clear from FDA, the National Boards of Pharmacy, and many others that if we want a secure drug supply chain, we ultimately need an electronic, interoperable, unit-level tracking system that can identify illegitimate product in real time so that it does not end up in a patient's hands. We also heard repeatedly that creating this kind of system is doable. One of our witnesses told us that it is already being done in China. Unfortunately, the bill we are considering today could actually slow down the progress we have made thus far toward building that kind of system. The bill does not require the establishment of an electronic interoperable unit-level system. By 2027, 14 years from now, FDA would be required to issue proposed regulations for such a system. But there's no requirement that these regulations ever be finalized. And if they are ever finalized, they cannot go into effect for at least 2 more years. Almost certainly, we're looking at 2030 or beyond under this proposed bill. This may be a small improvement over the previous version of this bill, which didn't even mention the establishment of an electronic interoperable unit-level system, but it is a very small improvement indeed. I cannot support a bill with these kinds of delays and uncertainty about whether we will ever even see an electronic interoperable unit-level system. I say this not just because the bill would preempt on day one strong state laws that are already in effect in places places like, among others, California. I say this because it removes the incentives for the parties to come to the table and solve the problem. There is simply no reason to wait to put out enforceable standards in place. A bipartisan draft in the Senate requires the establishment of a unit-level electronic interoperable system within 10 years, and it is not a contingent on FDA rulemaking. FDA is required to establish this system based on the requirements in the statute. I'm concerned about the preemption of California's and other states' laws in both the Senate and the House bill. I do not think even the Senate bill goes far enough to provide the same level of protection that California does, and I think it should be strengthened. At the very least, the House bill should be at least as strong as the Senate bill. Our fundamental goal in establishing a federal system should be to prevent Americans from being harmed by counterfeit and substandard medicines. If we cannot assure the public that legislation will establish a system that will protect them by a date certain, then it is not worth doing. I urge members to oppose this bill. We'll have amendments to discuss when we go to the markup.
Chair, thanks, gentlemen. Now recognize the gentleman from Georgia, Dr. Gingrey, 3 minutes for opening statement.
Thank you, Chairman Pitts. I'm pleased to see 2 bipartisan bills in front of the Health Subcommittee tomorrow morning. It's a testament to the hard work of my colleagues that we have these bills which serve to improve our government's ability to review animal drugs as well as track pharmaceuticals through the supply chain. I am particularly pleased to see a vote on H.R. 1407, the reauthorization of Animal Drug User Fee, ADUFA, and Animal Generic Drug User Fee Act. I'm not going to try to say that acronym. But this reauthorization will make it possible for more expedited review of both brand and generic animal drugs. Mr. Chairman, it is impressive that in my home state of Georgia, livestock, which includes poultry, beef, pork, eggs, dairy, and equine, accounts for nearly 10% of the $68 billion that the agricultural sector contributes to our state's gross domestic product. By reauthorizing this user fee bill before us, we will provide the resources that will continue to allow more animal drugs to market. These drugs will allow veterinarians and farmers to safeguard the health of their animals, and these approved products will assist in managing animal health. I am pleased that this bill is a result of close collaboration between industry and government regulators, where both parties recognize the need for continued drug development and approval to protect both livestock and, of course, public health. I believe that this reauthorization is necessary, and I urge my colleagues to vote for its passage. I'm also pleased that there has been a general bipartisan acknowledgement that a secure pharmaceutical supply chain is not only necessary for patient safety, but becoming attainable as tracking technology continues to improve. The legislation, like the other bill before this committee, hopes to establish a transparent process to secure our pharmaceutical supply chain that will ultimately benefit from close collaboration between the FDA and industry stakeholders. I would hope that the legislation that ultimately is a result of the markup tomorrow, will balance both the realities of today's emerging technologies with the flexibility to change as a result of innovation. This legislation will provide a clear, concise list of expectations and directives to all companies up and down the supply chain while protecting patients from increased costs. We must foster an environment that will see steady industry progress toward increased drug security and that is not impeded by a lack of clarity from Congress as to the ultimate goal of this legislation for both the sake of innovation and security and for families who may be adversely impacted from counterfeit or stolen drugs. Mr. Chairman, thank you, and I yield back.
Chair, thanks, gentlemen. Now I recognize the ranking member emeritus, gentleman from Michigan, Mr. Dingell, for 5 minutes for an opening statement.
Mr. Chairman, I thank you for the recognition. And I want to commend you and the chairman of the full committee for staging this meeting today and for the progress we're making on two important pieces of legislation, the Animal Drug User Fee Act and the Animal Generic Drug User Fee Act. These pieces of legislation are very important, and they will be important to securing our downstream drug supply chain safety. It is our shared goal to ensure that pharmaceuticals that millions of Americans take every day are safe and have not been stolen, misbranded, counterfeited, or otherwise altered. This is something, regrettably, that the committee found in years past to be a very major problem. I also want to thank my friends, Mr. Matheson and Mr. Latta, for their hard work on this draft bill that we're considering today. I'm a co-sponsor of the bill because it includes many critical improvements from the original discussion draft released last week, the most notable being the inclusion of a process to implement a national unit-level traceability system. Now, I'm not going to sit here and tell anybody that this legislation is perfect. The last perfect legislation came off Mount Sinai with the prophet Moses, and it didn't last very long. In short, the draft bill is a result, however, of good faith compromise that will make substantial improvements over the status quo. I believe that progress should be rewarded, and I think that the legislative process should move forward. I would note that there is excellent prospects that as we go through this, considering at different stages of the process, the Senate bill, the different proposals before this committee, that we can create from this a good piece of legislation that can be supported by all of us. And I certainly hope that we will achieve that goal. I want to make it clear that I think progress can be made, and I look forward to working with my colleagues on both sides of the aisle to that end. I note the Senate bill is a bipartisan compromise. If the Senate can do that, I see no reason why the House cannot too. At the end of the day, it's my goal, and I think my colleagues share that goal, to enact a fair, feasible traceability system where all in the supply chain are responsible for ensuring the safety of chemicals and pharmaceuticals and making it easy for bad materials to be purged from the dealer's shelves. So I want to thank you for your courtesy. I look forward to working with all the members to achieve our goals, which is safety. And I yield back 1 minute and 54 seconds of time. Thank you.
Chair, thanks, gentlemen. Now recognizes the gentleman from Florida, Mr. Bilirakis. 3 minutes for opening statement.
Thank you, Mr. Chairman. I appreciate it. The Animal Drug User Fee Act, which once amended will include the Animal Generic Drug User Fee Act, is an important bill that will help to ensure that new innovative animal drugs and cheaper generic animal drugs get to the market in a timely manner. Animal drugs help contribute to the health and well-being of animals and the overall public health. It allows our farmers to continue to raise healthy animals, protecting the integrity of our food supply. These user fees are used by the Food and Drug Administration to hire additional technical staff to deal with the drug application process. This prevents large-scale backlogs from developing. With the necessary staff, FDA can approve future animal drugs without adding to the burden on taxpayers in this era of trillion-dollar deficits. In return, the FDA agrees to hit certain benchmarks to ensure that these user fees is money well spent. I also want to thank the Chairman and, of course, Chairman Upton for bringing up the track and trace bill. I know that this bill has been in the works for a few years now, and I'm glad that we are finally nearing the finish line. This bill will provide for the safety and security of our pharmaceutical supply chain. It will establish unified national standards and penalties for violations of these new laws. It takes us down the path toward unit-level tracking of pharmaceuticals, clarifying the process that allows for a safe and steady supply of necessary medications. We will have the ability to track drugs in the supply chain and trace the path any drug takes from the factory to the patient. This legislation has the support of the entire industry, from the manufacturers, the wholesalers, the third-party logistic providers, and the drugstores, both chain and independent drugstores. This is a very diverse coalition, and their support speaks to the strength of this bipartisan legislation. I support the passage of these bills. I thank the Chairman. I yield back the balance of my time.
Chair, thanks, gentlemen. Now recognize the gentleman from Utah, Mr. Matheson, 3 minutes for an opening statement.
Thank you, Mr. Chairman, for holding this hearing. Working to develop a policy to strengthen the integrity of the pharmaceutical drug supply chain has been something that I've worked on for nearly a decade, and the discussion draft we have before us today is the next step in that effort at work. Chairman Emeritus Dingell first brought this issue to my attention several years ago, and I'm glad he got me involved in this issue. And along the way, I'd like to also thank Congressman Latta for his work in the current Congress, and in previous Congresses had a chance to work with both Congressman Bouyer and Congressman Bilbray on this issue. So it's been a long time coming, and this is the furthest the issue's gone. And I'm confident that we have an opportunity here to get a product through the House and the Senate and get to conference on this issue, and we need to do this. As news stories over the past year long have indicated, there is a very real and very present need to strengthen our drug supply chain. There is a tempting market for bad actors to exploit gaps in our security when you've got $325 billion prescription drug market in the United States. A recent Wall Street Journal article indicated that the illegitimate drug trade, that being counterfeit or adulterated pharmaceutical products, may be more lucrative to bad actors than trafficking in illegal drugs. This is a problem that's only likely to grow, and it's important that we make an effort to try to secure our chain, the supply chain, even more. This discussion draft takes immediate steps to strengthen the supply chain, as well as provide a clear, predictable, and responsible glide path for industry stakeholders to achieve full unit-level traceability. It's crucial that we strike a balance between stepping up much-needed security protocols and providing enough time for the FDA to consult with private sector interests to ensure that the systems put in place are achievable, do not increase drug costs to the consumer, and ultimately protect patients from counterfeit and adulterated products. And I believe the timelines in this draft strike that balance. Inaction could add billions of dollars in regulatory costs to industry and patients. And I have to say that the other reason why it's important we move on this is the draft will replace what is a growing patchwork of different efforts in different states. In fact, my understanding is now 29 different states have some level of effort where they're looking at this issue on a state basis. That's unrealistic. We don't need a patchwork system. We need one national standard. Now, several improvements have been made in this draft compared to when we first looked at it 2 weeks ago in this committee at the suggestion of stakeholders and members of this committee. Most notably, as I stated earlier, the current draft now requires the FDA to set up a clear, collaborative process to achieve full unit-level traceability. I'm proud to have worked with my colleagues on both sides of the aisle to make these changes. I know we will move forward in this hearing, the amendment process, and look for other opportunities to improve the bill. This is an issue that desperately needs congressional action, and this draft puts us on a path to get there. Again, Mr. Chairman, thank you for holding this markup, and I urge all my colleagues on both sides of the aisle to work in a productive way to try to move this bill through the process. I yield back.
Chair, thanks, gentlemen. Now recognize the gentlelady from North Carolina, Mrs. Elmers, for 3 minutes for opening statement.
Thank you, Mr. Chairman. I commend the committee, Mr. Latta, Mr. Matheson, Mr. Upton, and Mr. Dingle for their hard work on this important piece of legislation. I strongly support efforts to secure the pharmaceutical supply chain and develop a national standard to trace products throughout it. This draft legislation would enhance the security of the supply chain for patients while preventing duplicative federal and state requirements. While I support the overall legislation, I do have some concerns. There are 11 lines of text tacked on at the end of this draft bill concerning e-labeling, and this is where some of my concerns lie. I would argue that the issue of e-labeling deserves its own debate, separate from e-pedigree, especially after the GAO report to this study that is studying this actual very issue will not be released until later this year. The argument that an exclusive e-labeling system enhances patient safety is not conclusive. No substantiated proposal has ever been made by advocates of e-labeling as to how this information is to be conveyed with respect to the following circumstances. In the course of a natural disaster, such as a hurricane, when internet cell service and electronic power are unavailable for extended periods of time over large geographic areas. With respect to those thousands of health professionals, such as paramedics, who need this information outside of a doctor's office, hospital, or pharmacy. For armed service medical professionals on ships, in submarines, at forward operating bases in war zones, and other fields of battle. One argument put forth by advocates of e-labeling is that no one reads the paper leaflet anymore, and so it is a needless expense. But my concern, of course, is first and foremost for the safety of the patient. And at this point, although electronic filing and electronic information is very, very useful, there is no better safety net for patients than a paper leaflet provided by the pharmaceutical manufacturer and regulated by the FDA. In North Carolina, I have a pharmaceutical printing account of 1,000 jobs. The Challenge Printing Company in my district alone employs 200 people. 100% of their business is pharmaceutical printing. I'm also concerned with the timing, format, and structure of how dispensers receive transaction information and documentation. I'm hopeful that these issues can be worked out in the conference committee at the end. And, Mr. Chairman, I yield back the remainder of my time. Thank you.
The Chair thanks the gentlelady. Now recognize the gentleman from Texas, Mr. Green, three minutes for an opening statement.
Thank you, Chairman Pitts, for holding this markup today, and I'm glad we're working on legislation in a collaborative manner. I want to help move the process forward. However, part of that process is disagreement. I have concern with the track and trace bill because it doesn't go far enough soon enough. We should not be closing the door on developing an electronic interoperable unit-level system as soon as practical. By prohibiting it outright for several years, we're boxing ourselves into a corner. The technology moves fast, and an electronic interoperable unit-level system that all stakeholders can agree upon may be possible to implement before there is a political will to revisit this issue again. We've seen technology moving faster than our legislative process, that with the Telecom Act and many other areas. The bill in the Senate appears to strike a good balance, and I hope we can look at it as an example and work toward achieving a compromise that will become law. My reservations about the House bill are substantial, and I do not support it in its current form. However, I support moving the process forward, and I want it reported out of subcommittee so we can address these issues in the full committee. I thank both Mr. Matheson and Mr. Dingle on our side for their work on this issue. We must act to secure our drug supply chain. It's too important for patient safety to allow this window of opportunity to slip by. And I thank you, and I yield back my time.
Chair thanks, gentlemen. Now recognize the gentlelady from Illinois, Ms. Schakowsky, 3 minutes for an opening statement.
Thank you, Mr. Chairman. I'm pleased that the committee could come to an agreement on the animal drug use fee amendments, user fee amendments, but I do not support the track and trace legislation as written. I absolutely agree that we need a nationwide system that ensures the safety and security of prescription drugs throughout the supply chain. Patients fighting life-threatening conditions should not have the additional burden of worrying whether or not their treatment could fail due to receiving substandard or counterfeit medications. We must create a system that prevents this. That system must eliminate the vulnerabilities in our current system and ensure that no illegitimate products enter our supply chain. At our April 25th hearing, we heard from experts that the only way to truly secure our pharmaceutical distribution supply chain is through the creation of a nationwide interoperable electronic system of tracking at the unit level. Creating this system must be our top priority. At that hearing, several concerns were raised regarding the initial draft of this legislation. Some of these concerns include the failure of the draft to require unit or package level tracking by a date certain, as well as to require adequate verification of return medicines. These deficiencies hinder our ability to secure our supply chain. While this updated draft addresses some of the concerns, this legislation falls short. The passage of legislation that fails to require the eventual implementation of an interoperable electronic system of tracking would leave our system vulnerable to the entry of substandard drugs. We can't allow this. We've heard from the experts. The solution to secure our supply chain is the creation of this nationwide interoperable electronic system. We've heard from industry. Industry can establish the system by a date certain, such as the 10-year requirement included in the Senate legislation. Let's listen and pass legislation that creates this nationwide system that ensures that only safe and effective medications reach the hands of consumers. Thank you, and I yield back.
Chair, thanks, gentlelady. Are there further opening statements? Chair reminds members that pursuant to the committee rules, all members' opening statements will be made part of the record. The Chair now calls up H.R. 1407 and asks the clerk to report.
H.R. 1407 to amend the Federal Food, Drug, and Cosmetic Act to reauthorize user fee programs related.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. The Chair recognizes himself for the purpose of offering an amendment in the nature of a substitute. The clerk will report the amendment.
Amendment in nature of a substitute to H.R. 1407 offered by Mr. Pitts.
Without objection, the reading of the amendment is dispensed with. For the information of members, we are now on H.R. 1407, and an amendment in the nature of a substitute is pending. The committee will reconvene at 9 a.m. tomorrow morning, and I remind members that the Chair will give priority recognition to amendments offered on a bipartisan basis, and I look forward to seeing all of you tomorrow. Without objection, the committee stands in recess.